gentlemen, good afternoon. After many speeches given by esteemed leaders, let's go on with, this is the last panel, right, of the day. So collectively, let's see what kind of solutions can we provide to some of the challenges we have in this region and hopefully for the future. The topic is aging pandemics and path to innovation. It's a conversation about implications of an aging population, lessons learned from COVID, and innovative approaches to healthcare. Well, one of the things I need to say before I introduce all these gentlemen on the stage is that our region, Asia Pacific, is dynamic. But at the same time, it is experiencing a trend of aging population. If I could just share a few numbers with you. We are now having 2.9 billion population. Now, 630 million are already over the age of 60. And by the year 2050, that number is going to double, which means 1.3 billion. As a result of that, we're going to see a lot of changes in our society. Very different needs compared to what we are talking about today. And as you know, while the population is getting more aging, the age group from 0 to 14 right now is contracting from 28% to 19%. So this is the reality we're facing right now, and that's why we're trying to figure out what does it mean for us, and what does it mean for policy making, for the business community, and for our society. And we are so glad to have the three gentlemen sitting on the stage. Kevin Xu, CEO of MEBO International in the middle. We also have Fernando Ríos, CEO of Rímac Insurance. Last but certainly not least, Chang, CTO of Quanta Computer, Inc. So good to see the three of you. We would like to start by every one of you helping us to understand how you would come in to this conversation, from which angle. Fernando, because the topic has a lot to do with the pandemic, aging, and innovation. I know you want to link what we learned from the pandemic to the aging issue we're facing. So please, let's start from you. Thank you.
Thank you, Tian. It's an honor to be here, sharing this panel in such a great company. Thank you very much for the APEC CEO Summit organizers to giving this space and this time to discuss about the most relevant topic, which is healthcare and well-being. Our healthcare systems are under pressure, under stress every day. If we continue doing the same, it will only get worse. And we learned from the COVID-19 pandemic that we need gaps in our systems to face this challenge. We all suffer with the pandemic, and Peru was hit the hardest. We were the country with the highest death rate, 8 times the global average, 8 times. It cannot happen again. But the reality is that today we only have 1.6 hospital beds per 1,000 people, far below the global average of 3.4 beds. And for us, this means that we are always at full capacity. It means also that we need more infrastructure. This need represents an opportunity for APEC investors because we have at least to invest $17 billion just to close the current healthcare infrastructure gap. To be ready for the next pandemic, we must cooperate, we must collaborate, but at different level, with more sense of urgency. We can't wait to have another pandemic to start acting together. And we propose to work in 2 specific spaces together. One is resource allocation, vaccines, medicines, tests, and the other one is knowledge sharing, protocols, information, best practices. Because we think that only Together, we can build the resilience we need to face this challenge.
Thank you very much, Fernando. I'm sure you have further details to explain to us a bit later. Let's go to you, Kevin. Tell us more about which angle you are coming in. As far as I understand, you are in the field of bioscience.
Well, first of all, I think it's an honor to be here and talk and share the insights with the CEOs around the world, especially in this APEC platform. I believe, especially after the pandemic, because for us, we actually understanding there's a balance between the needs of advancement in technology, but also how we really taking care of people-centric directions for the next breakthrough of science. And we know that the urgency is needed, especially when we're trying to prepare for the next pandemic, but also because there is an overburden in the global population that grow more aging alike. And because of that, I still want to stress on the fact that we have to find a balance point. And for us, we understand that aging is a course of life. And there are unmet medical needs. How we figure out the right way to physiologically help people successfully age, and meanwhile achieve the advancement of science and technology. That is our priority.
How to so-called successfully aging. Yeah, thank you. Let's go to you, Ted, please.
Yeah, although everybody talk about technology, but technology is not the future. And Quanta computer is the biggest computer maker on this planet. But Quanta computer is not AI, but without computer, there is no AI. But AI could be useless. If you apply AI, cannot make our medical system or health system much better. So the goal is basically whether we can apply the right technology, integrate into a new environment to support the society of the future. And the biggest challenges right now, of course, is the growth of elderly population. And so we will be lack of enough medical resource, enough medical doctors, and we don't have enough the nursing center to host everybody. So one of the thoughts is that can we do aging in place, but still we can provision a much better professional medical care directly to the elderly at home. And so in that directions, you can see that every people will need to stay connected. So you need IoT devices, vital sign, sensors, and connect everybody, collect the data, and put it inside a cloud, even a private cloud or public cloud, do data analytics, and then you can have AI. Then you provision the AI as a useful, the tools at the point of care. So that's a simple thoughts from the technology side, but it could be applied to many new applications in the future society. Thank you.
Thank you so much. I think many of you have been touching on so many different buttons. For example, health issue, social work, infrastructure, city planning, transportation, the list goes on, right? I mean, all of you touch on points from different angles. So what is the priority here? Because we certainly cannot work on everything all at the same time by putting emphasis on of the same degree on everything. So where do you think is the priority, and how can we more efficiently move toward that direction? Go to you.
Okay.
Yes.
Okay. So, well, definitely when I talk about we have to really pay more attention to aging population, especially we know that besides technology, they need to really fulfill their self-dignities. And they also have to fulfill their independencies and be inclusive to the communities. And therefore, when we talk about how to get themselves involved with the emergence of new technologies, we have to consider what are the approach to collecting the information, especially not only the information we receive from, for example, the database, the internet, but also people who work at the front line. Because we talk about, for example, in University of Southern California, there's a school of gerontology that focus on the study of aging, which is really important because we know there is a gerontologist that specially focus on how to combining the biological aspect and the sociological aspect of aging. So therefore, all these new technology which being developed, or all those devices, have to be considered for the best fittest to the aging population.
Can you give us some example? It sounds a little bit abstract.
So for example, when we talk about how to reform the elder care facilities, we have to to put in new consideration of different aspects. For example, we have to have the measurement of the stairs in between to make sure they fulfill to prevent the falls. And because of that, you are taking a people-centric perspective as your initial focal point. And also, we have to provide enough assist to make sure the elder, they can also have a slowly trained of their own muscles, own abilities to be self-independencies as well. So therefore, all these stuff are beyond the understanding and knowledge of the traditional social workers that we've been well known.
I certainly want to concur with what you suggested, which is to respect the elderly and make sure there's independence of that generation. But given the different access to resources that we see in the Asia-Pacific region, and the number that I just mentioned, Kevin, do you think it's really realistic?
Well, I would say there are a lot of components we have to be really recapitulate on it, because we're knowing that for this, as I mentioned before, right now there's still a fulfillment of medical needs, especially in the chronic illness. And we're knowing that these chronic illness, without a solution, without a reversible case, they will continue creating a direct and indirect cost to our health system. And because of that, really to overcome the aging population overgrowth is beyond just a single outbreak of technology. It's an entire reformation of the healthcare system. And if we can consider that as a global stage, an APEC platform, then it needs to be a synergistic effect that's being imposed.
I'll let you explain a little bit more about how a bit later, but let's just go to you, Ted. Your thoughts on what can be the priority? I mean, certainly you're a digital guy. You suggest AI all the time. But even about AI, there are AI gap we have been talking about throughout the past 2 days. There's also policy about AI. As you know, there's so-called AI Act in certain countries, which means that technologies of somewhere might not necessarily can be have access to in other parts of Asia Pacific in the future. So how do you see this, AI, quote unquote, as solution?
Thanks for the wonderful questions. I think the most important thing is that we need to place AI at the right positions that it can create the biggest value. That is the first thing. For example, to do that, you need to do understand the real world problems so that you can collect the right data and provision AI as a service at the right, place. So basically, one of the example I can tell is that more and more elderly, are facing, the 4 problems. When people fail on the ground, and basically, it's very difficult to, to call other peoples because you are underground. And if you want to put, vital sign sensors or wearables attached to a person, then it's still, it won't work in all occasions because sometimes you are in the toilet or in the restrooms and you are taking a bath. And so one of the technologies that using different kind of radar to scan you, get out the point cloud, based on the detection of the point cloud, they understand your gesture and posture, and they will call for example, your son, your neighbors, and to help you. So that's one of the very simple the applications that simple AI can help. So I'm not talking about generative AI, large language models, but of course for generative AI they can help you to find drug a much better drug in a short period of time. But deep learning AI actually very helpful in deploy to the real environments, so that you can educate more people and to let them understand what AI can help. And so that they can increase the adoption of AI. And so that's another direction to consider.
But of course, you also understand the so-called elderly generation has relatively more difficulty having access and using the latest technologies compared to, let's just say, the younger generation. That's another layer of this, the public advocacy and also know-how. It's another layer of what you just suggested.
Yeah, could I add one more
yes,
thing?
please.
Is that I think the most difficult part is to make the technology invisible. So it's not using visible technology. To make it invisible, simple enough for the elderly to, the person to use. It's very important. So we don't claim that's an AI, but that's some assistant that can help in your daily works. So that's some of the things that people try to do. It's not about talking people. The good thing about technology is about tell them what technology can do for you.
Right.
That's different direction.
Fernando.
Aging is inevitable, and
thank you. Thank you. Yes.
It's inevitable, and we need to think how to reshape our society, obviously, from different industries: transportation, housing, and also healthcare. But for me, the most important point to discuss is how we see aging, because we can see aging as a problem, as a challenge, or we can see aging as a gift. To see as a gift is not only about adding years to life, it's about adding life to years. And to achieve
Ladies and gentlemen, we're going to the philosophical part of this conversation already. Okay, be prepared. Please, Fernando, go ahead.
And to achieve that, we need to work in a totally different approach. We need to put prevention first. And maybe I can share an example, a specific example, about how we are doing that. Years ago, we redefined our purpose, and we decided to make this vision a reality for our clients. And we started investing in well-being. We created Está Bien, a well-being digital platform that offers guidance and tools to enhance your digital health, physical health, and financial health.
Yeah. And no advertisement for products.
No.
Yeah. No, it's just kidding. Go ahead.
Yeah. And we decided to promote as a first phase exercising. And why exercising? Because it's the single most powerful habit to be healthy. And we partner with some brands and communities like Peru Runners to encourage our 600,000 starving members to run. And this is something interesting because numbers show that people that exercise regularly can reduce the healthcare expenses by up to 40%. And this is why we say that there is only one way to face the aging challenge, and is to preventative care.
Okay, well, I see all of you, both of you want to jump in on that. Please, Ted.
Yeah, I think one of the things, I just want to echo that, Fernando just said. I think, although when we talk about health, we are very focused on physical health. But there is another side of health, it's on mental health. So, the properly, define the programs, that cultural program, the, entertainment program in the community is also very important to keep elderly life, back to normal. And so when their, life is then longer than before, people try to, think they still can contribute to the society. So the point is that how you can define and design many good activities and personalize the activities to help the elders. And that's another way of using applied advanced technology to do that. So for example, in Nordic area, the major problem is not physical health. is mental health. And so when we deploy our systems or solutions, telehealth solutions from Asia to Nordic area, they said our people are much healthy than yours. What we care is mental problem. It's not your body. So that's different thoughts.
Right. Well, these gentlemen are certainly logical in providing their solutions, and they are everywhere in terms of the priorities. But I want to remind you of the urgency, if I could. I have two personal stories to tell you, not about me, but rather about people I know. For example, nursing home. As we see populations, for example, in Northeast Asia, Japan, China, also South Korea, I think, aging population in urban areas, a big challenge. You will see people line up years in order to get their parents into some of the best quality nursing home because they want to show their respect. It's the cultural tradition of our region. But it is so hard to get in that people of my age, and even younger, they're already thinking about pre-registering for themselves when they are getting old or getting aged. That's one example. The other example is one of my girlfriends who's also a public figure. And of course, you get friends to invite you to dinner or to social occasions. So she told me she would not accept a lot of them. But if there are presidents coming from hospitals, friends like that invite her to dinner, she would love to go to because she would say to them, please take care of my parents. Stories like these are so real in the region. I think every one of us is a daughter, is a son, is a parent. Many of us are parents as well. So how that story of urgency is tapping into your years of solution, that's what I want to hear, if we could, for the next 8 minutes. Gentlemen, would that be good, you think? Okay, so Ted, please, you go, and then I go. Sorry, Kevin, you want to go first?
Yeah. Good one.
Okay, well, I just want to say it's really important that how we really gather the information we receive and find a universal standardization. And then we take the next approach, right? Because we knowing that, especially we know there's medical needs among different countries because of their diversity, because of our different backgrounds. There are always going to be different ways of communicating. But however, the key here is we have to work together, not only with government, the private sector, but also with the nonprofit, the association, which they also have the direct contact with the patient advocacies, with others, research scientists, because we know that there are always going to be a universal care for the world. And that's the major part that, for example, there's a lot of opportunity to have briefing sessions among different regional leaders in development of science related to aging, related to other advancement. And that's what we need, is to gather these leaders to have reach to a collateral of agreements.
If I could just follow up, because there are certain products that we are doing trade, which is contributing to solving the problems of aging. Whether the trade policies are going to be friendly to those exchanges among economies, it's just one of those many questions we need to ask today, given the circumstances of our meeting today. So Fernando, go to you also. What do you think about that urgency?
It's something totally urgent to face the aging challenge, because imagine that we want to be in shape when you are 70 or 80 years old. You need to start today doing exercise, eating healthy, because I will insist in the approach of we need to develop preventative care now. We need to move the healthcare system from curing people to caring for people. And we need to start doing different things today. Exercising is hard, eating healthy is hard, but to live with diabetes or a heart disease is harder. So we need to invest in new services, but at the same time, we need to invest in preventative care.
Yeah. There's a long laundry list that we need to do, I see, but the question always is how, right? Go to you, Ted.
You are asking a very tough question. What would be the urgent question, right now? First of all, I think something we have to do right now is because aging is not a process of getting old. Sometimes you will get old right away, within one day, according to the research. The second thing is that once you suddenly get old, you are incapable to do something. What would be the society can support you and to get your life back to normal? And that's what technology is trying to accomplish. But imagine if a city with full of elders, that also, in reply to your questions, the smart city of the future is your future nursing home. They have to host millions of elders in the city, which means that we need to restructure the city, make it friendly to all the elders. And the elders is not another group of people. It's our future. We will all get old. So we will need to start to consider what kind of city we would like to stay and what kind of problems that we're going to solve. And this would rely on, just like Kevin just mentioned, rely on huge amount of, public-private partnership. It also rely on, how we can connect our limited medical resource through telemedicine, telehealth, and also AI, and to make up not 100%, but at least we can further improve that. And another thing is that how we can keep, elderly, healthy enough through, health promotion programs, exercise, and also society programs, social programs, to bring everybody out of the home and to live a much better life. And so that will be a very complicated problems in the future. But I think the urgency is that we all need to do it right now. Otherwise, we will get old, quickly. And we don't know when. It's not about age. It's about your mental and physical condition.
It's also about our priorities in looking at the future, how we are going to re-streamline the structure of our economy, our society, in order to fit into the realities of tomorrow. Before we go, I think this is the last session, and therefore I would like to ask every one of you very briefly about your takeaway of this session, and you think people can take away with them for this discussion, and certainly for our whole summit as well as an individual, your personal takeaway. I start from Fernando and we move over there, okay? Yes, please, Fernando.
This is a crucial moment, a pivotal moment to reshape the healthcare industry globally. We need today all the tools to do that because there is a special moment in the world. Some people call this moment the fusion era because there is a technological convergence very powerful, and this technology allow us innovation and create access and create preventative care. And just to finish, I want to say thank you very much for visiting Peru. I hope you are enjoying our country and discovering all the vast investment opportunities at hand.
Thank you so much, and we love the beautiful city of Lima, and thank you for the hospitality of Peru. Thank you so much. And let's go to you, please, Kevin.
I would say is really quick. Okay, so basically, I think the future of science rely on human-centric. And even though you are like, for example, the APEC economies, everything really devoted for human, and everything is devoted for life. How we improve life, that is the powerhouse of science and knowledge. So I believe for the few farther after, especially after the pandemic, what are we waiting for the next generation is to prepare ourselves with human-centric driven technology as our mentality.
All All right. Last but not least, Ted, please.
I think one of the main themes that I pretty much appreciated from Peru is about people. So I believe that the future healthcare of the people, by the people, and for the people will be the most important things. And we are lucky, by the way, allow me to do some commercial. And next year, we're going to have a working group dedicated to biotechnology and also healthcare. Thanks to the APEC, we will have a working group so that we can coordinate all 21 economists' efforts.
Okay.
On this efforts. Yeah,
well, that advertisement, quote unquote, is allowed on this stage at least. So, ladies and gentlemen, thank you so much for this session, and thank you also for your contributions. Thank you.